In this podcast, Dr. Patricia Farris, a dermatologist in Metairie, Louisiana, and Dr. Peter Leo, a clinical assistant professor of dermatology and pediatrics at the Northwestern University Feinberg School of Medicine in Chicago, tackle the hot topic of sensitive skin and barrier dysfunction. The duo take a deep dive into how skin barrier function impacts skin health in patients with sensitive skin and what over-the-counter ingredients are particularly beneficial for such patients. Spoiler alert, hyaluronic acid, natural moisturizing factors, NMFs, and epidermal lipids top the list.
I'm Dr. Patty Farris. I'm a board-certified dermatologist. I'm from Metairie, Louisiana.
And I'm Dr. Peter Leo. I'm also a board-certified dermatologist here in Chicago, Illinois.
So we're here to talk today about sensitive skin and barrier dysfunction, something that all dermatologists are interested in and face in their practices every day. I think we all see lots of patients who come in who have complaints of sensitive skin, stinging and burning, what we call cosmetic intolerance syndrome. And there's lots of things that, unfortunately, patients do that exacerbate this problem. These include, of course, sun exposure, exposure to pollutants, using harsh ingredients, high pH cleansers, smoking. Unfortunately, cigarette smoke can damage the barrier. And then things like over-exfoliating. When they're trying to do good things for their skin, they unfortunately compromise the barrier.
It's such a great point because we have not only the things that are really tough to change, the environment around us, but then we have some of the things that we can change and often sort of do the wrong thing with good intentions, especially when we have an underlying skin problem. If we're dry and flaky, people feel like the instinct should be to exfoliate. If they have acne, they feel like they're dirty, so they're trying to clean and scrub, and this can actually backfire and cause more damage. So I think, as you put it beautifully, we're really searching for products that can very gently do their job correctly so that we can address the main issue without causing any of the untoward responses and, of course, result in patient satisfaction. So they'll stop seeking and see the improvement in their skin.
Absolutely. I think there's a lot of ingredients that we tell these patients to look out for, things like fragrances, again, those alkaline pH cleansers, certain preservatives can trigger them. I'm sure you have a list as well because you deal with so many patients with compromised barrier.
There are so many. And one of the hardest things for me as I've gotten older, you kind of get that Socratic ignorance and you realize that sometimes being dogmatic about what you absolutely must avoid can work against you, because at the end of the day, the formulation is probably more important. The actual, what is the actual on the ground experience of it? I think it is possible to have a formulation that maybe has things that in another context aren't so good for you, but in this particular formulation are okay. But that being said, you're right. We have to be careful of so many potential allergens and irritants and things that can damage the skin pH, especially for patients who aren't sure. You have someone with sensitive skin, you have someone who's already had a bad reaction, or in my case, somebody that has atopic dermatitis. Well, we can't really take a risk because sometimes a product might be doing help, but also some harm and making things worse. And then we can't disentangle and figure out what's going on. So I really want to use the gentlest things that I know so that we can build from there.
And I think we also have patients that we all face that we know have barrier dysfunction who may not have a lot of symptomatology, but are acne patients, rosacea patients who tend to be, again, part of the pathophysiology of those conditions we now understand as barrier dysfunction. There's also some things we'd like to see patients using, things like NMF, lipid-containing moisturizers, or ceramides, cholesterol-free fatty acid, all of those good things that help keep the barrier intact.
I think it's such an important point, and it really brings up the question, what is sensitive skin? We know so many people now self-diagnose with sensitive skin, and I don't think they're crazy. I don't think it's just a fad. I think increasingly, and it may be in part due to the modern world, it may be in part due to the fact that we're all a little bit more in tune with our skin, but I think that sensitive skin syndrome is real, and many people feel these different feelings, and I've read some different papers on it. I know it's a bit slippery. I don't think it's a clear diagnosis. We don't have a diagnostic criteria, but we know for some people, it's a reactivity. It can be almost a predilection towards inflammation from certain products. For others, it can be more of a neurological or more of a sensorial aspect. I've heard people refer to this as sort of the people that give the sensation of stinging or burning. And that's important too. That's a real thing. And then finally, there can be mixtures of these things where it can both feel bad and look bad, causing inflammation, redness, flushing, kind of a neurovascular aspect as well. So all all of these things sort of get put into this bin of sensitive skin. And at the end of the day, for me, and I'm pretty sure for you too, it's if the patient feels they're sensitive and if they feel that they're having a reaction to a product, whatever that may be, then it's our problem. And we want to make sure we're avoiding it and looking for things that are ideally suited or tested in people that report sensitive skin.
I agree with you 100%. Such a nebulous diagnosis, but if the patient says they have it, I think we all assume that the patient has sensitive skin. Talk about clinical studies. I know there was a recent study done where they actually looked at patients with cosmetic intolerance, acne, rosacea, eczema, and looked at how they reacted to moisturizers and whether those were in fact tolerable, and as well as did they improve their skin condition.
It's really remarkable. I think there is a literature on this. And part of the problem is, as we've alluded to, is that the definition of the disorder and the definition of what is free from irritants or things that could potentially aggravate is also a little bit slippery. But you're right. The study that I saw very recently suggested that a combination of some really nice ingredients, things like natural moisturizing factor, some really healthy lipids, in the context of a formulation that didn't have a lot of the things that we're concerned about. It didn't have a high pH. It didn't have things like urea that can sometimes also irritate. It didn't have fragrances. In this context, it was really, really helpful against protecting from environmental triggers, things like ultraviolet radiation and pollutants, things that we're exposed to every day. And I love a study like that because it's very functional, it's very practical. And I think at the end of the day, you can show me lots of basic science and show me why something might work. And I feel like in my other world of thinking about botanicals, every plant basically has some antimicrobial and some antioxidant aspect. So to show me that and say, well, look, this is going to be great for whatever disease because it's antioxidant and anti-inflammatory. I say, well, wait right there. We really want a clinical model. It could be an animal model. It could be an ex vivo model, but we really want to see how it all comes together because at the end of the day, lots of things are anti-inflammatory. Lots of things are potentially antioxidant, but in practice, we really need to be able to demonstrate this. And that's what that study was able to do.
Yeah, such an interesting study. I also thought it was interesting that they looked at the same moisturizers, and we're looking at the Hydro Boost products here, the water cream and the gel cream, and looked at them across all Fitzpatrick skin types in patients with eczema, rosacea, acne. And the acne patients were also on medications, topical medications, and then those cosmetic intolerance patients. And they saw a reduction in the symptoms, the stinging, the burning, the redness, the itching, the tightness. And then they also saw improvement in various skin parameters. So I think this is a great study because it really shows us that not only are these moisturizers very tolerable, but they also improve that symptomatology and the skin's appearance, which is so important to these patients.
I totally agree. And I think that's the right paradigm and framework for a study to show both some objective things like the skin barrier function, things that can be photographed like erythema, but also getting the subjective aspect too, because these patients did also report that improvement. So that's to me, the holy grail.
Yeah, that's the glue that sticks it together for me too.
A moisture sandwich in skincare refers to layering products to enhance hydration and minimize water loss from the skin. Recent research presented at the annual meeting of the American Academy of Dermatology investigated how the open sandwich moisturization regimen and the full sandwich regimen affect the bioactivity of retinols and retinoids.
Another interesting study that was done with these moisturizers was looking at the sandwich phenomenon that I call the TikTok sandwich theory, using a moisturizer with a retinoid. The sandwich phenomenon or I guess experience is you put a layer of moisturizer on, then your retinoid, and then you put another layer of moisturizer on top. And this is touted widely by dermatologists on social media to improve the tolerance of the retinoids. The study was an ex vivo study, so we don't have symptoms or things like that to look at here. But the study was still very interesting. And what they found was they used the retinoids, both of them. It was retinol 0.1%, as well as tretinoin 0.025%. Both were creams. And they did what they called the full sandwich, which was moisturizer, retinoid, moisturizer. And then they did open space sandwiches. So in one of them, they put the moisturizer on first and then the retinoid. The other one, they put the retinoid on first and the moisturizer over. And they looked at the efficacy of the retinoid. And what they found was when they did the full sandwich, the efficacy of the retinoid was greatly reduced. Both tretinoin and retinol. And they were looking at upregulation of epidermal growth factor, which we know occurs with retinoids, as well as HAS3, hyaluron synthase 3. So this was a very interesting finding. The full sandwich greatly decreased the efficacy of the retinoid. The open face sandwich, irregardless of whether you put the moisturizer on before or after the retinoid, maintained bioactivity. So this is, to me, such an important study because it really gives us clinical guidelines as dermatologists. Early on, when a patient's really intolerant of retinoids, that full sandwich may be the way to go. But as we move forward, if we want to see bioactivity, then the open sandwich method is probably preferable for the long term. I love this study because I have been searching the literature to try to figure out where this came from. Now we have a study really looking at commercially available moisturizers. Again, these were the two Hydro Boost, the water cream and the gel cream, looking at bioactivity and how they affect retinoids. Such an important study, I think.
I also like it because we can almost sort of stack it up depending on what the patient needs. If we think that they're just maybe a little sensitive, we'd say do your open sandwich because we know we're going to get really good efficacy and it's still pretty gentle. But if you need a little more buffering, then go the full sandwich. That's going to help really minimize that. And then to me, that kind of the mildest way to do it for those patients who can barely tolerate it is to do the short contact therapy. And of course, remember from the old days when we had some of the stronger retinoids in rotation, people couldn't tolerate them. So put it on for a few minutes. I say brush your teeth and wash it off and moisturize. So that would be kind of the weakest of the weak, barely doing anything, but maybe allowing you to slowly adapt to that.
Yeah, such a great point. I forgot about short contact. That is a great point. So I think we really have covered all of the data on these recent studies on these moisturizers, but I think the thing that we maybe could leave the listeners with is that these are specifically formulated for patients with sensitive skin, for patients who may have various inflammatory skin disorders, and studies have shown that they're tolerable. Also, this great sandwich study shows that they can, to some extent, improve the tolerability of retinoids, and again, affecting only the efficacy of the retinoid if they're used on the full sandwich.
I love it. And this is an incredibly exciting time because we can just see how far the science has come to address the needs of this really important patient population.
Thanks for listening.
Thank you, everybody.
Thank you for listening. We hope you learned a lot about hydration for clinically sensitive skin.